Hello, this is Gary Crowley with DoItYourselfJointPainRelief.com, and this is video 1 of 3 videos for releasing back pain in your lower right side. This is intended as a quick fix where I'm going to cover the 3 main culprits for back pain in your lower right side, and if these do not do the trick for you, then please do visit the main lower back pain relief page where I run through basically everything that could be causing 95% of all back pain. So if this doesn't do it for you, feel free to click over to the lower back pain relief page and I'll run you through a whole bunch of other techniques that will allow you to get rid of your back pain. So in this first video, what we're going to do is we're going to release basically the lower part of your hips, because when these big hip muscles get tight, they yank on basically your hip bone and your tailbone here, and your lower back muscles that are a lot smaller and weaker basically lose the tug of war. They get inflamed, they hurt, but usually the big bullies are down here. So basically on my I have a whole page dedicated to what I call the tennis ball tune-up, where I show you basically how to sit on tight tissue, stay on that tender spot with that pressure of your body weight, and then move your leg to make that tissue move under the pressure of the ball, and that allows the tissue to release. And also, if you want to go to my techniques page for a minute, I run through the 4 basic techniques in 4 very quick videos to show you effectively how to do what I'm about to show you. You know, you can do it here, but also feel free to visit the techniques page. So I'm a big fan of tennis balls, but lately, especially when I really wanted to give people a quick fix for this lower right back pain, I've become a fan of the softball or even the baseball for what I'm about to show you. So, you know, ideally, if you have a softball, that'd be great. Baseball, tennis ball will do in a pinch. But let me just show you what we want to do here. Is we're going to be aiming at all this tissue, all in this upper half, basically of your butt. And no matter what ball you use, that's what we're going to be doing. Now with a tennis ball, I gotta be a little bit more able to get in some kind of interesting positions, which is hard for some people to, you know, do this, especially if they're in a lot of pain. So I've come to realize that the old softball is just a wonderful way you put that ball below your hip bone here, but in any of that soft tissue, and you just feel around for tender spots. Now here I get to lay nice and flat, and when I find a tender spot, I just kind of lean into it and move my leg so that tissue under the ball has to move. I'm not going across, I'm not trying to massage it, I'm not doing any cross fiber stuff. I'm putting pressure on the ball, on that tight tissue with the ball, and then I'm moving my leg in a way that makes that tissue kind of have to function underneath the pressure of my ball. When it releases, you know, even totally or even, you know, just a little bit after a while, you can move to another spot and move your leg to make that tissue move again. And then you might turn on your side a little bit and do that. If you want a gold star, you can turn, really get that side of that hip, that little muscle called your tensor fasciae lata, and you're just going to go all along. You can go back if there's any tender, stubborn spots. You can go back, visit them now that you've released other stuff. It always helps. And you're just going to release all that. And when you feel like you've done a pretty good job of releasing all that tissue in that basically upper half of your butt, then I want you to stand up. And I want you just to notice, maybe assess how much better that right back is. And if it's a lot better, then you know, you can go on with your day, or you can continue to free your body so that it's less likely to return. Now, even though your pain was on the right side, and that's usually the main culprit, I now want you to try it on your left side just to make sure some of this tissue over here isn't also yanking on that tailbone of yours and causing your right back pain. Sometimes, you know, if you're driving, sitting in a computer too much, a lot of times both sides are a little tight. But you do that same thing as before. Press into a tender spot. If you really, if you need a ton of pressure, you can come up like that. Or you can lift your other leg up and have all that weight from your hips on there. But you're just making that tissue move and turning, making it move under that ball. And you just play around, investigate a little bit, and you'll find what makes it move. After you do both sides, then again, self-assess. How's that back feel? Hopefully it's feeling a lot better, since this is often just the big bully kind of yanking on your poor back. And so that's video 1 and technique 1. And after you've self-assessed, and you might go back and do a little more, I will see you at video 2, where we're going to release the muscle on basically the inside of your pelvic bone that no one ever thinks about. That is, again, often a big player in lower right back pain. So thanks for your time, and I will see you at video 2. Thank you.